line that I gave to the press when they asked what happened in court is that we're winning, but we haven't won yet, and it's really important to keep stressing this. We're going to really need your help to make sure that we use the victory that we've had in court to go on and actually achieve what we want to, which is to keep our services in the NHS. So, Aneurin Bevan, the health minister at the time when the NHS was founded, said that the NHS would exist as long as there were folk with the faith left to fight for it. And this is a big prize for the private healthcare sector, because there's a lot of money to be made from the NHS if they can get at it. So this is really important. The second point is that it's one of the best healthcare systems in the world. You know, time and time again there are studies that show this. And an important fact that is not getting mentioned enough on the news at the moment is that it's also very efficient. Globally, the percentage of our gross domestic product which we spend on health is actually much lower than it is in many other places. Particularly, I mean, America is the best example. Despite the fact that it's privatised and they don't actually offer healthcare to lots of people, they spend an enormous amount of their GDP on it because they're basically giving money to shareholder profits. The most important point is just that I really feel incredibly strongly that healthcare for all is a sort of... I can't believe that this is something we even have to discuss. Is how I feel about it.
You know, we know that the private healthcare companies at the moment are saying that our NHS is an unopened pearl of profit to be made. And I think that what this case and the support that we've had so far has shown is that this NHS, you know, it doesn't belong to the NHS managers. It doesn't belong even to political parties or to governments. It belongs to us.
It can seem like, oh, well, we had that protest and that didn't do anything, and then we had a court case and that's actually got us somewhere. But without the protest, you know, the people who were working on the legal case would not have been inspired to do it. And without that pressure of public opinion, we would not be pushing NHS Gloucestershire into making an out-of-court settlement or into doing what we need them to do now.
It wasn't difficult for me to want to take this case. The National Health Service is working perfectly all right. Of course it's not perfect. No system on earth is ever perfect. There can be room for improvement. There's no need to take it to bits and start all over again and make radical changes. Health care does not belong to the marketplace. In a sense, we won the battle in London, but we haven't won the war yet. Okay?
So what we faced here in Gloucestershire, and probably the first that many of you heard about it was when we had the demonstrations and the meeting here last summer, was they were going to be transferring Stroud Hospital and 9 hospitals across Gloucestershire and 3,000 staff, that's all our district nurses, all our podiatrists, loads and loads of nurses and health visitors. They were going to be transferring those staff out of the NHS and into an unaccountable social enterprise. It was presented to us as, oh, this is a done deal. This is already happening. It's too late to do anything about it. And that's what we were told. So this is why we had to go to court, not because going to court would solve everything, but because it would buy us time to actually do what we need to do now, which is get on with the rest of the campaign to keep these services in the NHS, and that's what we've done, and I think we all need to be very proud of ourselves, because everybody, not just the people who went to court, had a really big part to play in that. Where this has originated from is this idea in the NHS that you need to split the commissioners, the people who pay for the care, and the providers, the people who provide the care. Now that's been something that's been going on for a long time, but it doesn't mean that they had to go down the route that they chose to go down here in Gloucestershire. In most of the rest of the country, these hospitals, podiatrists, all these services are still being provided within the NHS. And that's what we need to keep. They come out of the public sector. You know, the public sector is accountable to all of us. We elect public servants and they make decisions over it. If it comes out of it, it's just not accountable in the same way. It's also a business registered at Companies House and it's liable for VAT, and that's going to add huge costs. I've seen the secret options appraisal that KPMG prepared for the Primary Care Trust, which said that actually the main positive benefit for management of moving towards this social enterprise would be that they could cut terms and conditions for staff. And of course that would mean worse care for all of us. And these are all the points that the QC, the barrister, outlined in court. He showed all the ways that these services could have stayed in the NHS had been wrongly ruled out, unlawfully ruled out, and we saw lots of evidence of that in the documents that were disclosed in court. he showed devastatingly how, despite all the talk about how social enterprise was about staff ownership and blah, 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 that actually staff views had been totally ignored. And he showed how leaving the NHS would damage patient care. And he stood up for a whole day and said that in a great deal of detail. It was very impressive to see. And at the end of it, the next day what we expected was that NHS Gloucestershire would come back and defend themselves. And they didn't. They phoned up and they said, we want to talk. This is what the PCT and Mr Lloyd agreed, that they would basically go back to the drawing board, that they would look at the NHS options. As it says here, they would consider a wide range of options, including entering into an arrangement with an NHS trust to deliver these services. They kept in there the possibility of these services being delivered by a community interest company. Frankly, that's completely off the agenda. There's no way that that is going to happen now. The key thing is really that so long as NHS bodies come forward to take over these services, and that could be another NHS trust like Together or the Acute Trust, or it could be a standalone new trust, so long as an NHS body comes forward, they don't need to competitively tender, they don't need to open it up to the private sector. I'm stressing that because you might hear people imply something different. Actually, in the end of the day, what this says is it's not going to be the law that decides what ultimately happens now. It's going to be political pressure and political will that decides what happens now. And
I know about social enterprises, I definitely know about social enterprises, and that's one of the reasons why I oppose this so vehemently, because there's a very big difference between social enterprise on a small scale as an alternative to private provision where there's a need that isn't being met in our society. There's a very big difference between that and using social enterprises to outsource public services.
What we now face is that the campaign's got to continue. The court case has given us some time. By court order, they've agreed to look for NHS options, but we need to make sure that that's actually what they do. We know that they failed to consider these properly in the past. As I said, I've seen this sort of secret options appraisal that they no doubt paid KPMG lots of money for, and they didn't properly consider things like Together Trust or the Acute Trust at all. They didn't even look at the idea of a standalone trust. For our hospitals, for our district and community health services, there's actually a really good fit, a really good kind of fit from a clinical point of view, from a patient care point of view, of these being provided jointly with the Together Trust. A lot of these services used to be run together in Gloucestershire anyway, and they admitted that it made a lot of sense to do that. Both for the Together Trust and the Acute Trust, they were interested in taking over these services, because together they're much, much stronger from any sort of takeover in the world of commercialisation that we're now going into. So there were lots and lots of reasons why it would have been good for them to merge. When I had a look at the reasons why KPMG were saying it wasn't so good for them to merge, what it basically boiled down to was that it would be a lot of work for managers and that it would be quite difficult for the accountants. And that's all they had. That's all they had about why it was a bad idea. So I think we need to be saying to them, it's our needs as patients and citizens of Gloucestershire that you need to be taking into account, not the workload of people that probably get paid quite well to do this. The options I've mentioned, the Together Trust and the local Acute Trust, the Gloucester Hospitals already. There are a couple of others. The Great Western Ambulance Service is currently being pushed into a merger where it will be run from Penzance. They're not too happy about that. So that's another option for these services staying in the NHS. There could be another NHS body from another county. Already, for example, Together is working with Herefordshire, so there's a lot of cross-county NHS stuff happening already.
But interestingly, despite the fact that the PCT board claimed that the body of these services couldn't possibly be merged with them, they had to go into a social enterprise. Actually, our local prison health services, which were part of the original thing, were merged with the Together Trust, and our local maternity services, which obviously has a long history of people fighting to defend, were merged with the Acute Trust. So it's entirely possible, aside from the fact that this has been shown very clearly in court, it's just quite obvious from that fact that it's entirely possible for the remainder of these services to be left in the NHS.
There is an indication that the Department of Health is claiming that the safest legal option might be to go to a full competitive tender. Now, that conflicts with our legal advice, which says that's entirely unnecessary. Our legal advice has prevailed so far. Our legal advice has been proved to be right. So who are you going to listen to, and whose case are you going to be pushing? Now, we know that NHS Gloucestershire has been in contact with the Department of Health. We know that the Department of Health told them not to fight the case at the end of that day, when it looked like they were going to lose. The Department of Health did not want them to lose the case, because what that would have done is say, actually, everything that's happened across the whole of the South West is unlawful, and that would have opened up a right can of worms, yeah?
Caroline and James told you a little bit about the court case. Can I just say how amazingly unusual it was for the PCT to completely cave in on day 2. They had so fundamentally got the law wrong, and it was clear after day 1 that they understood how fundamentally they had got it wrong. They had ignored basic rules about procurement and the regulations that informed the way the NHS ought to operate. And the court order says that they have to go back to square one. This time, their process has got to be open and transparent. They have got to properly consult with everybody, including patients and members of the community and staff. If there's one message that you take away with you tonight, it is they do not have to competitively tender for these services. Whatever they do, it is within their own choice, but they can look for these services to remain within the NHS, and there is no need for there to be a competitive tender at all if they can secure a trust within the NHS to take over. The complicating fact, obviously, is that the Health and Social Care Bill may become law, in which case from 2013 the PCTs are abolished, and you will move into a situation where you have commissioning groups. Certainly not something that's not going to happen in the next few months. Over the next 12 to 24 months is going to be a sort of a timescale that's reasonable.
I think it's passed its third reading in the Commons on Tuesday night by a majority of 65, 316 to 251. And I don't really think this is that important, but 4 Lib Dems voted against it and 10 abstained. Over 1,000 amendments were added at the last minute in ways that couldn't be challenged. If you watched it on television, you'll have noticed that very few MPs actually attended the debate. And 90 minutes was spent discussing a last-minute discussion about abortion, which Nadine Dorris, the MP, tabled. So they weren't even talking about really the substance of the bill. However, it's not law yet. It's still going to go to the Lords next week. And more importantly is the poll tax example showed even when legislation gets passed, it can still fail to be implemented if there's a big and strong enough movement to stop it from being implemented. We hear a lot that this health and social care bill isn't about bringing in the private sector. This is a kind of mantra that Lansley and Burns have been giving out. You know, people who think this is about privatisation haven't read the bill. That's what they keep saying. It's total rubbish. The headline was, "Read this and prepare to fight for your NHS." He describes the bill as a particularly complex and obtuse piece of legislation, about 3 times the length of the original 1946 bill that introduced the NHS. It's going to lead to the most extensive reorganisation of the NHS that's ever been undertaken. And of course that comes in a context when Cameron said that there would be no top-down reorganisation of the NHS in a Conservative government. And he also says that because of that extensive reorganisation, it's vital that people understand it so that they can decide for themselves if it's what they want for the NHS. And I think that's an important point, and an important point that people like Lansley, if they want to pass such a radical reorganisation, they need to get people on side, and people are not on side. They don't even understand it, let alone agree with it. One thing is that there's no longer going to be a single person who has responsibility for meeting healthcare needs of people in England. It's going to become decisions made by various different bodies. In particular, they're going to be transferred to these things called clinical commissioning groups, which are made up of GPs. And an important point here is that, okay, so this sounds like it could maybe be a good idea because they're frontline staff, but they're unelected, of course, GPs, whereas at the moment, these decisions are made by elected people. One consequence of this is that if you wanted to challenge any plans that the CCG's made, it's much more difficult to than if it was Landsby doing it, because their meetings might be held in private. They can decide to do that. There's nothing to stop them doing. Even if the GPs actually do provide these services, which I'll come on to is very unlikely, it's hard to avoid the conclusion that they're not going to be necessarily making decisions about where to send you for your healthcare or not to send you to healthcare on the basis of what you actually need, just on the basis of whether they want to save some money. Most of us hopefully want to trust our GPs, but you can't exclude that possibility, and that's a possibility encouraged by the bill. In summary, this means that health is not going to be planned on the basis of needs, but on the basis of the business plans of certain localities. You know, services that we rely on could be substantially reduced. In fact, it's not just they could be, I would argue it is almost certain that they will be. We see this any time you have privatisation, money needs to be taken out to pay the shareholders their dividends, so that money is no longer available for the service. It's kind of impossible to get around. Unless the business is for some reason incredibly much more efficient, and what's the main way of making the business more efficient is not paying the staff, so then the service suffers in that. The CCGs get to decide which stuff is free and which stuff isn't free. So even though we keep getting this mantra, it will still be free at the point of use, that decision about whether something is free at the point of use goes to the CCGs, and they can decide, well, we're not going to offer this without charging because it's not profitable. So there won't be any strategic health authorities or PCTs anymore. That means you don't have coordination between health services anymore, and indeed you can't, because that would be anti-competitive when you introduce this market. So if you're someone who's got complex healthcare needs where you need to go to different parts of the NHS, you might not get the joined-up care that you need. We also have this thing of making a two-tier NHS, lifting the cap on the amount of private money that our NHS hospitals can earn, which creates a natural incentive for them to earn as much money as possible from private patients, bump them to the front of the queue, push everyone else out. There's no plans to replace the Street Health Authority's role in organising teaching of doctors and nurses. So in 5 years, when we're running out of doctors and nurses, it'll be because of the Health and Social Care. And lastly, the accountability of the Secretary of State for all this. This has been something that's been debated, and there have been some amendments and so on, and there's an argument that the Secretary of State has more responsibility than he was going to have. But essentially, it's very vague, and it's severely compromised, and lawyers are going to be arguing about it. It's not clear that the Secretary of State has responsibility, whereas at the moment, that is clear, and that's how it should be. It's an incredibly detailed list of all the MPs and Lords who have a financial interest in this bill going through. And I started reading it, I spent 2 hours reading it, I didn't even get through the Lords. You know, people who are on the board of Circle Healthcare, a so-called social enterprise that's actually half owned by private equity, or more than half owned by private equity. You know, the extent of this is very deep. So, as well as the Stroud Against the Cuts website, which is still the main website we want to encourage all of you to use, because we talk about other cuts as well on it. We do have a sort of more simple, separate website for the Keep Gloucestershire's NHS Public campaign, which just makes the resources more easily available.
Okay, so just lastly, this was actually inspired by Neil Carmichael, I should say, who sat and told us when we asked him, do you support the right of these services to stay in the NHS? He said, I support the NHS, which is one of those statements that's a bit like, you know, I like flowers or something. So what we've come up with is this pledge, which we're asking everybody to sign.
Because people haven't still got a clue what the implications of this new act's going to be. And so more and more that we actually educate ourselves and educate our neighbours, that will be very valuable. So
GPs in particular, I've heard a lot of people say GPs are going to be really important, both nationally and locally, in what happens. And so talk to your GP. I read a quote the other day from Alice Walker, and it said the most common way that people give away their power is by imagining that they don't have any. And I think that we all need to be aware of our power.
So I think it's very exciting. We can do an awful lot here, and we shouldn't believe that anything is impossible. That's something we've been told by people who want to make things impossible to be changed. So I'm going to end there. Thank you all so much for coming, and thanks again to Michael Lloyd for his crucial